Hello, everyone, and welcome to today's March webinar. I'm Noah Reed, Vice President of Sales and Marketing for Precision Analytical, creators of the Dutch test. Our guest today is Dr. Kelly Roof, an expert in hormone health and wellness. She'll be covering the nuts and bolts of uterine fibroids, a complaint from many female patients. In this webinar, Dr. Roof will teach you to recognize the signs, symptoms, risk, and causative factors of uterine fibroids. Today's webinar is one of the many educational resources available through Dutch. Visit us at dutchtest.com and find a vast library of videos and educational resources to help you understand hormones and treat your patients' complex hormone-related issues. In the coming weeks, Dutch will add a new educational resource to our arsenal, a 5-module course to teach you the basics of using and interpreting the Dutch test. This masterclass will only be available and online for our registered Dutch providers. If you are not already a Dutch provider, sign up to become one today to have access to this exclusive Dutch education. Click the link in the chat to get started. And now let me introduce today's speaker, Dr. Kelly Roof. Dr. Roof is a licensed naturopathic doctor who completed her medical education at the National University of Natural Medicine in Portland, Oregon. She completed a private residency at Pearl Natural Health in downtown Portland, where she specialized in inflammatory bowel diseases and women's health. Currently, she is a clinical educator for Precision Analytical, creators of the Dutch test, where she spends most of her time educating on how urine testing can improve the field of women's and men's health. Dr. Roof loves learning about hormones and biochemical pathways in the human body, and she makes a point to share what she has learned through videos, blogs, social media posts, and podcasts with the hope that her education will help us find happiness and health. Thank you for joining us today, and Dr. Roof, the floor is yours.
Thanks, Noah, for that introduction. I'm just so honored and thrilled to be here with you all, and I am excited to jump into this topic on uterine fibroids. And, you know, a lot of women are affected by fibroids, so I think this topic is an important one. And some of the research studies say up to 80%, there's an 80% lifetime prevalence of uterine fibroids. So luckily, even if we have uterine fibroids, a lot of us will not have any symptoms, but some of us really do, and some of us really struggle with fibroids. So let's jump in. Let's talk about fibroids and Dutch testing. This is me. Again, I am a clinical educator here at Precision Analytical. This is my Instagram, Dr. Kelly Roof. I'm mostly just posting on hormone replacement therapy these days. And remember, the information in this presentation, it's for informational and educational purposes only. It's not to be used as medical advice or treatment advice. And in the United States, any statements regarding dietary or herbal supplements, they're not evaluated by the FDA. So just use this information solely at your own risk. All right, so the objectives today, we're going to talk a little bit about fibroids. What are uterine fibroids? We're going to go into how you can utilize Dutch testing to improve those clinical outcomes, and then go into treatment considerations. And I'm really hoping that after, in 45 minutes from now or an hour from now, you're going to walk away from this presentation feeling like you have a lot more tools in your toolbox, things that you can start using tomorrow to help your patients with uterine fibroids. Okay, so what are uterine fibroids? They're basically solid tumors that grow in the uterus. So you can see with this image here, these are these solid tumors. These are the fibroids. And most of them are non-cancerous. So I think it's less than 0.1% are actually malignant. So there are these non-cancerous tumors, these benign tumors that most women are going to have during their lifetime. And, I think about all the women out there who have uterine fibroids, who are struggling with uterine fibroids, who only know about conventional treatments, and they don't know about these more integrative functional medicine treatments. And there's after, when you watch this presentation, you're going to realize there's so many things that we can do to help prevent the occurrence of fibroids and to also just stabilize fibroids, possibly even help shrink fibroids. We're only going to shrink fibroids in a small percentage of cases. And if we have a large fibroid, it's not like we're going to use functional medicine or natural methods to shrink that fibroid so it doesn't exist anymore. We're probably going to rely on conventional medical treatments too. But so uterine fibroids, they can grow kind of all throughout the uterus. We've got these submucosal fibroids that can protrude into the uterine lining or into the uterine cavity, I should say. We've got these intramural fibroids, which grow within the uterine muscle wall, and these subserosal fibroids. So these grow on the outside of the uterus. And usually the ones that are involved with heavy bleeding, because remember, some women with fibroids have heavy bleeding, they're more these submucosal, these intramural fibroids. The ones that affect fertility, I think about submucosal, these can really kind of block, they can push pressure on and block the fallopian tubes. They can change the shape of the cervix, making it a little more difficult for the sperm to enter. They can make it so that the embryo has difficulty implanting. And there's something else that they do. I can't quite remember right now. But, oh, I know. So they can actually restrict blood flow to that developing embryo. So fibroids, they can be a big deal even when it comes to fertility. But some women with fibroids, fertility is totally fine. There's no issues there. Okay, so uterine fibroids, they affect about 1 in 5 women during childbearing years. And we have that lifetime prevalence of up to 70%, but some research actually says 80% in Black women. The incidence increases with age until the onset of menopause. So usually once menopause hits, remember when we hit menopause, our hormones like our estrogen tends to drop off. And you'll see that the uterine fibroids also will shrink around menopause. And there's a significant relationship between the presence of these fibroids and other diseases like endometrial polyps, endometriosis, and ovarian cysts. So I find that really interesting. So some signs and symptoms, like I said, a lot of women are asymptomatic. They don't even know they have a fibroid. But about 25 to 50%, they might experience some abnormal bleeding, whether that's clotting, whether that's heavy menses or spotting in between their periods, cramping, and even anemia. If they're losing too much blood, they could become anemic. People can get really tired. Even pelvic pain and pressure, kind of depending on how big those fibroids are and where they're located. Painful sex, urinary frequency, or even difficulty emptying that bladder. And some back pain, constipation and bloating, and infertility, adverse pregnancy outcomes. One thing I wanted to say about heavy menstrual bleeding, I found this really fascinating. So I always said heavy menstrual, like a heavy flow, is when you lose 80 mils of blood or more per cycle, per period. But we've actually changed the definition. So I thought we could all be aware of that. Now it's excessive menstrual blood loss, which interferes with a woman's physical, social, emotional, and or material quality of life. So it's not even just about a certain amount of blood loss. It has a new definition now. The symptoms, like I said, so they depend on how many fibroids someone has, the size of those fibroids. Bigger fibroids might be more problematic, and then the location of those fibroids. And fibroids, some of them can be as small as a grain of rice. That's pretty small. It's probably not going to cause any symptoms, right? But others can be as big as a melon. So just think about a cantaloupe in there. That's going to make you look, 16 weeks pregnant. It's going to have some you're going to be symptomatic. You're probably going to feel some pressure in the area. So they really do vary in size. Here's an MRI image of a very large uterine fibroid. I thought this was interesting. I asked a friend of mine who's a radiologist, I said, hey, can you look at this image I found and can you estimate how big this uterine fibroid is? And he's like, well, it's kind of hard to say, but maybe around like 8 to 10 centimeters, which I think is about the size of a softball. So they can get pretty big. And just wanted to have everyone remember, I like this little quote from Up to Date. It's important to note that the uterine fibroids, they're common, But, other coexisting conditions might be the etiology of the presenting symptoms. So if a woman comes in with heavy bleeding or painful intercourse or constipation or bloating, it might be the fibroids, but there could be some other things going on, right? So we don't want to just say for everything, oh, it's the fibroids. So the pathophysiology is it's really uncertain what causes fibroids. We don't really know. And it's probably different in every woman. But the hormones, we know that hormones, we know that oxidative stress, so inflammation, we know genetic factors appear to play a big role in fibroid occurrence and fibroid growth. And there's been various risk factors that have been identified. So we have a lot of research, a lot of research. Oh my gosh, if you go into PubMed, you'll find a lot of research on fibroids. But thankfully, we do have a lot of research because people have identified things that increase our risk, but also things that decrease our risk. So we're going to focus on those in this presentation. So here is a study from 2017, and it's just talking about how fibroids are estrogen dependent. There's been no prepubertal cases. So remember, in women who haven't gone through menarche yet, they haven't gotten their period yet, they don't have fibroids. It's after we start cycling, after we get our period, that those fibroids start to occur. And remember, they start to occur more commonly as we get older. And fibroids, they regress after menopause. Thank God, right? Because once we hit menopause, estrogen drops and we no longer have that estrogen fueling fibroid growth. So those fibroids tend to stabilize and they even tend to regress, to shrink. Fibroids, this is very interesting to note. Fibroid tumors, so the actual tumor tissue, has more estrogen receptors than surrounding tissue. So what does that mean? So this tissue, the fibroid tissue, has more estrogen receptors. So it's going to be more sensitive to estrogen, right? And estrogen fuels the growth of fibroids. So not only are we having estrogen acting on the fibroid tissue, but there's more receptors in the tissue, so it's more sensitive. So estrogen is going to play a big role. And aromatase, let's talk about aromatase. So remember, aromatase is an enzyme and it converts androgens like DHEA and testosterone over to estrogen. They actually found that aromatase is overexpressed in fibroid tissue. Isn't that amazing? It's overexpressed, even more so in Black women. And we'll see that fibroids are more common, they're more severe in Black women. So the uterine fibroid, the tissue is overexpressing. It's making a lot of aromatase enzyme. And what aromatase is doing is taking androgens like testosterone and DHA and converting them at a fast rate over to estrogen. So estrogen levels in the fibroid tend to be higher than what you find in the serum. And this, elevated estrogen in the fibroid tissue, what it does, one thing that it does is it does a lot of things, but one thing it does is it increases the expression of progesterone receptors. So this study puts it this way. It creates a microenvironment in which progesterone can induce fibroid growth. And that's really important to know, especially when it comes to adding on progesterone, progesterone replacement therapy. A lot of times women with fibroids might have heavy bleeding and they might have an estrogen dominant type picture, right? And so a lot of practitioners want to add on progesterone. No, let's just cycle progesterone 2 weeks out of the month. But the thing is, for some people, progesterone might actually cause those fibroids to grow. So it's not completely contraindicated, but if you do use it, it's going to be an individualized decision, and you just need to monitor fibroid size and growth, over time. Okay, let's get into those factors that increase risk. So as we get older, our risk goes up. Black race, your risk goes up. Early menarche, so women who get their period before 10 years of age have an increased risk. Oral contraceptives at an early range. This study looked at girls between 13 and 16 years old. They had a higher risk for fibroids. Family history. So there's that genetic component. No previous pregnancies or births. High blood pressure, obesity, chronic psychological stress, which stress is on every single list, right? So we all know too much stress is not good. A little stress is good, but too much is not good. Some more factors that increase risk: low vitamin D, certain environmental chemicals like phthalates, PCBs, BPA. We're going to get more into these and how you can avoid these, because I think it's super important when it comes to fibroids. Prenatal exposure to DES, we don't see that often anymore. And certain insecticides. So I think about pesticides too as a group. One study looked at beef and other red meats and ham, and they found that women who ate a lot of this tended to have increased risk for fibroids. But I will say, they also found that women who ate a lot of beef and other red meats and ham also tended to not eat many fruits or vegetables. So, some red meats from healthy sources could be helpful. I mean, not helpful, but might not be too harmful. Just we have to make sure women are getting those fruits and veggies in their diet and not replacing it with meat. Omega-3 fatty acids. So these are like our fish oils. But the researchers were thinking more so that they were kind of poor quality supplements. Maybe people were taking fish oil that wasn't purified, still had PCBs in it, still had some of these environmental toxins in them. So it's always important, get the fish oil from a good source, right? Food additives, alcohol, especially beer, and caffeine. This was more of a weak association with the caffeine. But Black women, they are just disproportionately affected. You'll see that the fibroids are more common, they're more severe in Black women. Interesting thing, phthalates tend to be higher in Black women, and vitamin D tends to be lower in Black women. So this could be contributing partially to that more, increased prevalence of fibroids in Black women. And Black women tend to be affected by fibroids at a younger age. Their fibroids tend to be larger, and they tend to have a higher risk of hysterectomy than white women. Okay, so let's look at factors that decrease risk. This is going to be important when we're trying to understand, okay, what can we do to help lower our risk for fibroid occurrence? Pregnancy, of course. Long-term use of oral contraceptives, there's some mixed research on that. But high physical activity, get moving. I know some people say even just movement in the pelvic area to kind of get more blood flow, more lymphatic flow to the uterus. So pelvic tilts, belly dancing. I mean, you'll see over here, I've got my little trampoline, right? Trying to get movement in every day in between consults. But just kind of getting that movement in every day is going to be really important. Green vegetables, going back to the veggies and the fruit. And when it comes to fruit, especially citrus fruits, really interesting. So think about those lemons, those grapefruits, those oranges, and vitamin A from animal sources, and dairy. So there was one study that looked at dairy in Black women, actually found that women who were eating more yogurt, they were looking at yogurt and dairy. They were eating more yogurt tended to have less occurrence of fibroids. So interesting, right? I just say get the dairy from a good source, organic, grass-fed if possible, and just make that decision based on each individual. Some people might have more kind of reactions or sensitivities to dairy. So definitely always want to make it personalized medicine. So here are some conventional treatments. I'm not going to go through these in detail, but I wanted to just list them out for everyone and just say that it's important to know when we need to refer. So we can do as much as we can with supplements, with lifestyle, with diet. We can decrease those risk factors. We can increase the things that tend to lower risk, but we need to know when to refer. So let's talk about Dutch test patterns that are associated with uterine fibroids. Okay, this is going to be really interesting. So remember with the Dutch test, Dutch is an acronym for dried urine testing. Dried urine testing for comprehensive hormones. There we go. So we're looking at hormones like estrogen, progesterone metabolites, testosterone, DHEA, and their metabolites. We're looking at that in the urine. We're also looking at cortisol. We're looking at organic acids. Um, it's a comprehensive test. It's easy to collect at home, and we can actually see different patterns on the Dutch test that might kind of help us understand what could be contributing to someone's fibroids. So the first pattern, it's obvious, right? Elevated estrogen. So on the Dutch test, you can see these dials here for estrogen. And here we have the parent estrogens, estrone and estradiol. And down here, there are 3 phase 1 metabolites, the 2-OHE1, the 4-OHE1, and the 16-OHE1. So on the estrogen dials, we have these 2 stars, and it's shaded green in between. That's the luteal range. That's where we would expect estrogen to be during the luteal phase. And remember, the luteal phase is the 2 weeks before the period. But this woman, you can see here, she's got high estrogen. She's got estrogen excess. See how her dials are pointing above the upper star and they're red? So we know estrogen can fuel the growth of fibroids, so it can be helpful to identify any high estrogen on the Dutch test. And estradiol, this is the most biologically active estrogen in the body. But estrone, these phase 1 metabolites, they can still bind to estrogen receptors. So we also want to look at their levels. And here's an example of a cycle mapping report. Remember, the Dutch cycle mapping, what we're looking at are 9 data points throughout the month that can show you how your estrogen is fluctuating throughout the month, how your progesterone is fluctuating throughout the month. It could be a really great tool that gives you some more data points. For example, sometimes I see estrogen come back normal or within range during the luteal phase. But when you do a cycle mapping, you notice that their estrogen is getting really high during ovulation. And you're like, no wonder you've got fibroids. No wonder you have heavy bleeding and breast tenderness. Like your estrogen during ovulation is off the chart. So the cycle mapping can be super helpful. Here we can see these gray dotted lines. That's the lower and upper reference range for a typical 28-day cycle. So if we look at this graph, this is estradiol, remember our most biologically active estrogen. We can see that these points, some of these points are getting really high, really above range. And this woman, she had uterine fibroids, she had mood swings, she had heavy bleeding, and she had pelvic pain and pressure. All right, the other pattern I look out for is elevated androgens. And when I say androgens, I'm talking about like testosterone and DHEA. On the Dutch test, we're looking at about 8, I want to say 8 androgens. And for example, right here, we can see testosterone is above range. The dial is red, it's in the red. And the thing about the androgens is, remember we talked about aromatase. It's an enzyme that converts androgens like testosterone over to estrogen. So in women who have high androgens, sometimes you also see high estrogen because they have a lot of androgens to convert over to estrogen. So sometimes we're working backwards, and first we're assessing these high androgens. Why are there high androgens and how can we lower them? Because we'll have that trickle down effect and hopefully lower estrogen levels. Another pattern is elevated 16-OHE1. So remember, 16-OHE1, it's a phase 1 estrogen. It happens to be a proliferative estrogen. So imagine it binding to estrogen receptors and causing tissue proliferation. And the word proliferation doesn't really go well with fibroids, right? We don't want proliferation. So the 16-OHE1, it binds more tightly to the estrogen receptors than the 2-OH and the 4-OH metabolites. Those are the other phase 1 estrogen metabolites. And if we push too much down the 16-OH pathway, we might get more estrogen receptor activity. We might get more fibroid growth. We might have more heavy bleeding, breast tenderness. And the enzyme that's responsible for converting estrone to 16-OHE1 is called CYP3A4. It's, pretty popular enzyme, pretty common. People talk about it a lot. We'll go into more detail about this one. So here are 2 different Dutch test results, and I just took a snapshot of the estrogen portion. And we can see here on the left that the 16-OH percentage is elevated. So this pie chart tells you the relative ratios of these 3 phase 1 metabolites. And we can tell that a lot of the phase 1 metabolites are in this proliferative 16-OHE1 form. We want the percentage between 13 and 30%. And look, it's 49.2%. That's pretty high, right? This on the right-hand graph, though, I want to point out this 16-OH percentage is within range, 21.3. But if you look at the actual dial, the actual value of 16-OHE1 is high, it's above range. So we want to look at both the percentage and the dial to see if either or both of them are high. It's going to be important to take both into account because in both of these examples here, this higher 16-OH could contribute, it's possible, it could contribute to some fibroid growth. This is a very interesting pattern that we see. It's elevated quinolinate. A lot of people know about quinolinate and neuroinflammation. Remember, it's a neurotoxin, tends to elevate with general inflammation. But there's some research out there that has shown that when quinolinate elevates in the urine, you also tend to see more phthalates and vice versa. So when there's more phthalates in someone's urine, their quinolinate tends to elevate. So if this comes back above range on a Dutch report, maybe really look into phthalate exposure. We'll talk more about that. And of course, HPA axis dysfunction. Remember how chronic psychological stress can increase that risk for uterine fibroids? Well, on the Dutch test, this is page 5 of the Dutch Complete, the two examples here. This is going to tell us about cortisol production and a little bit about adrenal health, about HPA axis health. So usually when the stress is more short term, our body, our adrenals are just pumping out a ton of cortisol. We're really stressed out. We're trying to run away from the bear. After a while, sometimes it's months, sometimes it's years, after a while, after having high cortisol, we tend to have low cortisol. So the body is wise. We know that high cortisol long-term is not sustainable. It disrupts our immune function. It slows down our wound healing. It causes us to gain weight. It's not good to have high cortisol long-term. So eventually we have this negative feedback on the brain. And the brain says, all right, we're not going to make as much cortisol anymore. So we tend to have lower cortisol over time. So these are two patterns of HPA axis dysfunction. These are two patterns that tell me, hey, stress is probably playing a role. And of course, obesity. We know obesity is a risk factor for fibroids. And I just kind of circled. So, this is a list, first of all, of patterns we see associated with obesity on the Dutch test. And I circled the ones that are also tend to be associated with fibroids. You'll see down here, melatonin. There was a study that actually showed melatonin could slow fibroid growth. And it makes sense that it could. Melatonin is a very potent antioxidant. We know inflammation, oxidative stress, right? That increases risk for fibroids. So let's look at those functional medicine treatment considerations. Let's see, what can we do? And first, let's go over the goals of treatment. Number 1, always know when to refer for conventional treatment. Of course, know that some fibroids, they can't be managed with functional medicine or natural medicine alone. We want to improve the symptoms. We want to help improve that constipation, improve that bloating, improve the heavy bleeding, correct the anemia, and we want to stabilize growth and hope for regression, hope that the fibroids shrink until the woman enters menopause, because that's when they will kind of naturally shrink. So here's the summary of things that we tend to do in functional medicine to help avoid the occurrence of fibroids, but also help stabilize them. So lower estrogen if it's elevated. Another thing, if estrogen comes back normal, it doesn't rule out the possibility of xenoestrogens. Remember, xenoestrogens are these man-made chemicals that affect estrogen receptors. So even if that estrogen comes back normal in the Dutch test, just know the Dutch test, even serum testing, it's only picking up your endogenous estrogen or bioidentical estrogen. It's not picking up all the xenoestrogens. And we even know that some mold, some mycotoxins are xenoestrogenic, like they can actually act on estrogen receptors. So just keep that in mind. Lower the 16-OHE1 if elevated, lower the androgens if they're elevated, reduce stress, support the HPA axis, avoid things that increase risk, and then encourage the things that are going to lower risk. All right, so first off, lower estrogen if elevated. These tend to be the things that contribute to elevated estrogen. And you'll notice some of these are also risk factors or are associated with fibroids, like being overweight, age as we get older. Perimenopause can be a time for high estrogen. Increased aromatase activity, we talked about this. Endocrine disrupting chemicals, remember the PCBs, the BPA, alcohol. Remember beer, especially beer is a risk factor for uterine fibroids. What else? Inflammation, stress. So we really want to work on these. We want to work on the root cause. But at the same time, we can help support the clearance, the detox of these estrogens. Sometimes people who have poor gut function, who have suboptimal liver function, they're not clearing their estrogens or their androgens well. So some of these like DIM, I3C, the cruciferous veggies, the Apiaceae family, also known as the carrot family, rosemary, turmeric, curcumin. I mean, we've heard of a lot of these before, and these can all help just clear out the estrogen. DIM, I will say DIM, what it does is it takes estrogen out of circulation and pushes it into phase 1, mostly down that 2-OH pathway. Remember, those phase 1 metabolites were the 2-OHE1, the 4-OHE1, and the 16-OHE1. And the 16-OHE1, that was the proliferative one. The 4-OHE1, turns out that's the carcinogenic pathway. We don't want to go down that pathway too much. We can increase risk for breast cancer, uterine cancer. And then the 2-OH, so the 2-OH is the most stable of the 3 pathways. So we want most of our estrogen to go down that 2-OH pathway. That's good. So DIM tends to take estrogen out of circulation, push it mostly down the 2-OH pathway. Just know if you use DIM, you might lower estrogen levels. So if estrogen is high, it might be good. But if estrogen is normal or low, I don't know. And then I3C, what it does is it needs good stomach acid to convert to DIM. So the I3C, some of it converts to DIM, and then DIM does its thing for estrogen detox. But just know you need good stomach acid. So if you give I3C to someone who has poor stomach acid, it might not work the way you're intending it to. The cruciferous veggies and the carrot family veggies. So I think of things that you typically put in what I would call a traditional soup. So carrots, celery, parsley, coriander, and of course, rosemary and turmeric, curcumin. And these, we know, potent antioxidants. Here's a study looked at curcumin, and they show that curcumin could play both preventative and curative roles in the treatment of uterine fibroids. These are some more things that we use to support estrogen detoxification. And sulforaphane, a lot of us talk about sulforaphane these days. It's highest in broccoli sprouts. So you can sprout your own broccoli seeds at home and eat those. What's actually in the broccoli sprouts is the glucoraphanin. And then once those sprouts are crushed, maybe you're chewing them or you put it in a smoothie, that glucoraphanin converts to sulforaphane. And sulforaphane is what's going to be supporting estrogen detox. So some supplements will actually have glucoraphanin instead of sulforaphane. Just know that glucoraphanin converts to sulforaphane. And then calcium D-glucarate, this people tend to use to support phase 3. So to support the clearance of the hormones or the toxins, in phase 3. And this works great, especially if that beta glucuronidase comes up high in stool testing. We have resveratrol, NAC. These are potent antioxidants also. And then magnesium, the B vitamins, the choline, TMG, SAMe, these are more for methylation support. Magnesium is a cofactor for methylation. Some of those B vitamins are cofactors. And these B vitamins are needed in the folate, methylfolate cycle, the methionine cycle. So yeah, those definitely important. And choline. So choline converts to trimethylglycine, also known as TMG. And TMG is actually what's supporting the methionine cycle. So TMG helps convert homocysteine to methionine. And then remember, methionine converts over to SAMe, which is our universal methyl donor. And what SAMe does, SAMe goes over to COMT, which COMT is the enzyme that is working in phase 2 of estrogen detox. For example, it's taking the 2OH, phase 1 estrogen metabolite, and it's adding a methyl group to it, moving it over to phase 2, where now it's more stable, it's more ready for excretion. And so SAMe comes over to COMT, says, here COMT, here's a methyl group. And COMT says, thanks so much, SAMe. I'm going to take this methyl group, I'm going to put it on the 2OH, and I'm going to convert it over to a phase 2 metabolite that's more stable, more ready for excretion. Okay, so lower the 16-OHE1 if it's elevated. So these are all things that push or upregulate that CYP3A4 enzyme. Remember, this is the enzyme that converts estrone to that proliferative metabolite, 16-OHE1. So these are the things that we might want to limit or avoid. When it comes to medications, there are some medications that upregulate CYP3A4. Sometimes it's difficult or unnecessary to avoid those medications. But one thing you can see on here, polycyclic aromatic hydrocarbons. These are produced when gasoline, oil, coal, wood, garbage, or tobacco are burned. They're found everywhere. They're in the air, they're in the water, they're in the soil. They can stick around for months to years. We're all being exposed, but we can limit our exposure. And we'll talk right now about how we can limit that exposure. So I know if smoked salmon is your absolute favorite food, you can still have it, just maybe limit it, right? So these are some considerations for reducing exposure to these polycyclic aromatic hydrocarbons that tend to push the 16-OHE1. And one more thing, look at this list. I mean, aren't we seeing overlap here of things that tend to increase risk for fibroids? Like some pesticides, maybe caffeine, obesity, alcohol. We saw this in the research that some of these actually increase risk for uterine fibroids, and I think maybe they're increasing risk partially by maybe increasing 16-OHE1. But to lower those PAH exposure, limit inhalation of gasoline fumes. Don't hang out at the gas station too long, right? Limit inhalation of smoke from wood fires, and that includes if you're having wood fires in your home, make sure it's well ventilated. Limit foods that are smoked, grilled, charred over a fire, and that's not just meat, that could be vegetables too. And limit inhalation of fumes from oil heated at high temperatures. Some shampoos and cosmetics actually contain coal tar. So if you Google, ingredients that are, ingredients to avoid that are related to coal tar, you'll get a whole list. And you just want to make sure you're avoiding those in your cosmetics and your shampoos. Avoid mothballs. They have the naphthalene. This is an actual PAH. And consider an indoor air purifier. So these are things that inhibit the CYP3A4. Grapefruit, resveratrol, rosemary, wild yam, peppermint, oil. We just say, CYP3A4, it's a major detox enzyme in the body. It's involved in detoxing a lot of things, waste products, toxins, even medications. So if you decide you have uterine fibroids and your 16-OH is high and you're just going to take, just drink grapefruit juice every morning, just know if you're also taking a medication that gets cleared out via the CYP3A4, you could slow the clearance of that medication and more of it could stick around in your body and have a different effect on your body. So just use caution with these because they will slow down a major detox enzyme. Resveratrol. So resveratrol was on that list. There is some research that resveratrol can actually suppress fibroid growth, which is pretty amazing. Some people will take resveratrol in actual supplement. You can get small amounts from like blueberries, grapes, cranberries, very small amounts. A lot of people say even taking resveratrol in a supplement form, it's not very bioavailable, maybe not very effective. But, if you eat these fruits here and these berries, you might get a little resveratrol, but you're also going to get a lot of potent antioxidants and polyphenols and flavonoids, and those are going to help lower inflammation in the body. And we know inflammation and oxidative stress can affect fibroid growth, right? So, and we know just getting more fruits and vegetables in the diet decreases risk for fibroids. Resveratrol also in wine. I forget, I think I heard it was highest in some form of Cabernet. I forget, Cabernet Franc, I forget. But so resveratrol, it does inhibit that CYP3A4. It also inhibits this enzyme, CYP1B1, which decreases the 4-OH. Remember that carcinogenic pathway? And it induces something called quinone reductase. So basically, okay, let's go back a little bit. 4-OH, we say it's the carcinogenic pathway. 4-OH can become a reactive quinone, and then it can attach to the DNA and rip off and attach again and rip off and cause DNA damage. So, increasing risk for breast cancer, for endometrial cancer. What resveratrol does is it increases this quinone reductase activity. And what quinone reductase does is it takes that reactive semiquinone that's going to cause DNA damage and reduces it, kind of pushes it back towards 4-OH so it's not reactive anymore. So that's good. That's good, right? And it induces the NRF2, these antioxidant pathways, anti-inflammatory pathways. So the 16-OH is a phase 1 estrogen metabolite, right? We can help clear it out of the body by supporting sulfation and glucuronidation. And when it comes to sulfation support, and sulfation and glucuronidation, it's not just for 16-OHE1. It can just support estrogen clearance in general. But we know that inflammation blocks sulfation. So we have to assess inflammation in order to improve sulfation. Also, this is so weird, but we know hypothyroidism can affect a certain production of like a CDA bile acid. And for some reason, if we're low in these bile acids, we don't sulfate well. So, treating hypothyroidism can actually help you clear out your estrogens, which is really interesting. Supporting the gallbladder can help clear out estrogens. And of course, we can provide sulfur donors. Here's a list of a bunch of sulfur donors you could consider. And then consider supplementing with molybdenum, whether it's in a supplement, capsule, or just getting more from the diet. And glucuronidation support. Remember, we can also help clear out the 16-OHE1 by supporting glucuronidation. So that's sulforaphane, citrus fruits, curcumin, calcium D-glucarate. And sulforaphane, going back to sulforaphane, we said it's highest in broccoli sprouts. It supports phase 2 in general. So it's going to help support sulfation, glucuronidation, methylation. It activates these antioxidant pathways. It helps prevent DNA damage, similarly to resveratrol. But note that sulforaphane degrades in our stomach acids, so sometimes taking the supplement with glucoraphanin or actually eating the sprouts can be favorable. And then, of course, we want to encourage most of that estrogen to go down the most stable 2-OH pathway. So this we do with the cruciferous veggies, the carrot family veggies, rosemary, fish oil, avoiding high sugar, avoiding alcohol, soy, and flax seeds. And you can see some of these things are coming up over and over again, fish oil, rosemary, cruciferous vegetables, avoiding alcohol. All right, lower androgens. These are contributors to high androgens. And you'll notice some of them overlap, a lot of them overlap with contributors to elevated estrogen. But I want to point out here, in women, most of our androgens are made from our adrenals. So our adrenal health is really important. And when we have insulin resistance, our ovaries tend to overproduce testosterone. So regulating those blood sugars, also really important. And of course, for overall detox support, whether it's removing those PCBs or BPA or hormones like estrogen and androgens, the liver is your friend. It plays a role in all three phases of detox. And so when we think about liver support, we're thinking about those B vitamins, the choline. Choline is very high in egg yolks, for example. Inositol, NAC, all of these can help support the liver. And then avoiding things that disrupt liver function, like caffeine and alcohol, saturated fat, all of that can be possibly helpful too. Fiber. So fiber not only helps to bulk up the stool and help with phase 3 elimination, so getting those estrogens, those androgens, those toxins out in the stool, but it can also help with constipation and bloating that we see with fibroids. So reduce stress and support the HPA axis. This is a huge topic, and I'm not going to go into it because Dr. Debbie Rice has already done a webinar on it. So I would really recommend this one, Cortisol and Stress, How to Recover and Start Strong This Year. I believe Dr. Rice did this in January, very recent. So check this one out. So we want to avoid things that increase risk. And here's that list again of things that increase risk for fibroids. It goes back to the phthalates, the BPA, alcohol, limit that red meat, or maybe just get a lot more fruits and vegetables in the diet. Lower that blood pressure, lose weight if appropriate. Get high quality omega-3 fatty acids. Ensure there's optimal vitamin D levels. This one's really important. And of course, lower stress. So phthalates, phthalates are man-made chemicals. They're added to plastics to make them durable, pliable, soft. They're in a lot of things though. They're in perfumes, anything that says fragrance. They're in nail polish, shampoos. There's a whole list here. So they're kind of ubiquitous, but we can still do things to help avoid them. Bisphenol, like BPA, it's in receipts. It's in a lot of cans, and it can be in plastic water bottles. Even things that say BPA free, sometimes they have other bisphenols like BPS, maybe not that much better. And then PCBs. So these are man-made by, who do you know? Monsanto, of course. And they were banned in the 1977. So people realized just how terrible PCBs are and how they don't degrade and they stick around in our system forever, not forever, but for a long, long time. So it was banned in 1977, but they're still leaching from landfills and hazardous waste sites. So they're still getting into our water. And there are higher levels in fish, especially catfish, buffalo, carp. So, here's catfish. So you might be a little more selective in your fish selection. So plants don't tend to take up as much PCBs. So your fruits, your veggies, they're going to contain less PCBs than fish. But it's important to still wash our fruits and vegetables, right? They can still have dust on them that has some of these PCBs or pesticides on them. So ways to reduce our exposure to these chemicals. We can remove the fat and skin and not fry our fish. I know it doesn't sound that much fun. I mean, sometimes I like a really nice crispy salmon, but maybe, not eating it all the time. Eat unpackaged, unprocessed whole foods. We all know this, right? Use the fresh and frozen fruits and veggies, not the canned ones, right? Wash everything and limit the fast food, the processed meals. Use reusable produce bags, not the plastic at the store. Online, you can buy the reusable bags where you put, and they're light. You can get light ones, so it doesn't add to the whole weight of the apples that you're buying. It's not going to cost you too much more. Also, buy things in glass, store things in glass. When you are shopping, look at the containers. If it is in plastic, try to avoid those recycle numbers 3, 6, and 7. Try to avoid plastic wrap. Sometimes people use beeswax wraps instead. I think they work pretty decent, maybe not as good as plastic wrap, but sometimes I'll do beeswax. And then swap out your vinyl shower curtain for a fabric one. Avoid heating up plastics, avoid touching those receipts that have BPA, avoid things with fragrance. And even unscented products can still contain fragrance chemicals to hide other smells. It's crazy. This world is crazy, right? But you can avoid and clean up dust in your office, in your living space frequently, because that dust can have phthalates in them and can have bisphenols in them. And of course, we use the HEPA filters when we're vacuuming, the indoor air purifiers. Air fresheners have so many chemicals. Luckily, I have found some more kind of essential oil-based air fresheners, so look into those. And check out Environmental Working Group. I know a lot of you already know about Environmental Working Group, but they have a lot of education around using cleaner skincare, hair care, and household cleaners. The Environmental Working Group also puts out the Dirty Dozen and the Clean 15. And here's the Dirty Dozen. These are the ones that we should try to buy organic. But did you know that these lists are based on the USDA's pesticide analysis, which are not comprehensive? Like they don't even test for glyphosate. So just, take this with a grain of salt. This is the Clean 15. These are the ones that we don't necessarily have to buy organic. Sometimes buying everything organic is impossible or it's expensive. And then we want to encourage those things that decrease risk. So high physical activity is great. Those pelvic tilts, right? The green vegetables and the fruit, especially the citrus, vitamin A from animal sources, and for some people, dairy. So here's the summary. I kind of try to put everything on one slide, and I added a few others. So down here, there's a lot of research behind these too. Melatonin, iodine, green tea extract, antioxidants in general, probiotics, calcium, tomato, cinnamon, black cohosh. I didn't really look for research on castor oil, but there is a lot of research on a lot of these listed here in helping to stabilize fibroids or slow their growth. So I encourage you to look through this list. You'll notice that a lot of things are repeated over and over, like curcumin and resveratrol and avoiding alcohol, lowering pesticides. And one more study, I just thought this was really interesting. This is 2022. They looked at all the literature in the past 20 years, and they found a lot of the same things that we're talking about, vitamin D, vitamin A, fruits and vegetables, curcumin, dairy, selenium, and avoiding the heavy metals, those chemicals, smoking, getting more fiber and antioxidants. All right, so here are the references. That concludes our talk. And just wanted to say that, new providers to Dutch receive 50% off up to 5 testing kits. That's huge. That's a huge offer. And with Dutch urine collection, I really do think that it can illuminate some of these things that are contributing factors to fibroids. There's a lot of women out there that have get very limited testing who are not exposed to functional medicine. And the Dutch test, the urine test really can help these women understand their hormones to a greater depth, and it can really open up conversations around even how they're metabolizing their estrogen, and how that relates to their gut health and their diet and their stress levels. So it can really open up conversation. It can really help women understand, like, how do I decrease my risk of getting fibroids moving forward? Because the prevalence is very high, but also how can I stabilize my fibroids in the meantime? Maybe how can I try to avoid surgery or a hysterectomy? How can I possibly shrink some smaller fibroids? So I would just encourage people to take advantage of this offer. It's a great offer. And with that, I say thank you very much. I hope you enjoyed this presentation. I hope you learned a lot. And I'm going to bring it back to Noah for any questions.
Yeah, wonderful. Thank you so much for this great presentation, Dr. Roof. With the remaining time we have left, we do have a few questions that we're going to try to get to. We'll try to get as many as we can. If we're not able to get to your question, you can always call in to our Talk with a Doc during the day, or send us an email at info@dutchtest.com, and someone from our doc team will reach out to you. So first question, we had a few questions around this, so I'll try to sum it up into what the few questions came to. It came around intramurals causing greater bleeding than submucosal, and asking for a little bit of more explanation on that.
Oh, okay. Maybe I said that wrong. I think submucosal tend to cause more heavy bleeding than intramural. Hopefully that cleared it
Wonderful.
up. I
That
must
helps.
have said it wrong.
Yeah. Yeah, it must have. I think maybe said it backwards, but
I think I did.
that cleared that up. So the next question would be, how would you use EGCG in women with estrogen dominance, or should it be avoided?
EGCG with estrogen dominance. Okay. Um, well, we know that EGCG can help clear out estrogen, right? Um, and we also know that EGCG, I keep this in mind, EGCG is also a 5-alpha reductase blocker. So it can also affect androgen activity, which can be good if androgens are elevated, right? If we have high testosterone, if we have high alpha androgen metabolites, which alpha are the more potent, more active metabolites than the beta, then EGCG can help move testosterone metabolism more towards the beta, towards the less active forms. So EGCG, I think overall can be pretty helpful for estrogen detox and even helpful if androgens are elevated.
In your opinion, and again, Dr. Roof is a doctor, but she's not your doctor, but in your opinion, does, where did it go? Postmenopausal women with HRT, is it possible to grow fibroids as a result of hormone replacement therapy?
Yeah, that's a really good question. And when you look at the research, it says yes. Estrogen replacement therapy can actually cause those fibroids to grow. Hormone replacement therapy in menopause, it's not a complete contraindication. Like it's not like you can't use it. You just have to be careful. And a lot of times we're trying to use the lowest effective dose, and then we're going to be monitoring the fibroid size over time. But yeah, unfortunately, I mean, it can cause fibroids to grow.
All right, we've got two more questions we'll try to get to, and then we'll wrap up here. Intermittent fasting and water fasting, do you think that those would be safe with fibroids?
That's a good question. It depends. I would say it really depends on the person because for some women, intermittent fasting can be great at stabilizing their blood sugars, at lowering their insulin levels. And we know that if we can stabilize blood sugars, if we can lower insulin levels, a lot of times we're going to be lowering inflammation in the body. Um, we're going to be kind of helping with weight loss, which can, for some, if someone's overweight, might actually help improve the fibroids, stabilize the fibroids. So I would say for some people, yes, it could be helpful, but for other people, not so much. Like some people just don't have the adrenal capacities to support intermittent fasting, or maybe they have a history of an eating disorder. Maybe their body's not ready for it yet. And intermittent fasting means a lot of different things. So it doesn't automatically mean you have to jump into an 8-hour eating window and a 16 hours of fasting. Like we can slowly get there. We can just start off with 12 and 12 and go up to 14 and 10. So I would say for some people, yeah, I do think it could be really helpful for fibroids, but for other people, not so much. And especially cycling women, usually in their luteal phase, we want to avoid fasting, especially that week before we get the period. So yes and no.
Great. And last question, have you seen or read any studies showing improvements with using iodine for fibroids?
Yes. Yes, there is research out there that iodine can help with fibroid regression. So, yeah, it's interesting.
Wonderful.
Hmm.
Wonderful. Thank you all for joining us again today. Check your inboxes tomorrow for a link to the webinar recording and download the slides. Additionally, please visit the Become a Provider tab at dutchtest.com and complete the steps to become a provider if you have not already done so. All Dutch providers will have access to the upcoming functional hormone testing course and that special that Dr. Kelly talked about to receive up to 5 tests at 50% off. Again, thank you all for joining us today.
Thank you.